So, welcome to the Progressive Rehab and Strength podcast. I'm your host, Dr. Rory Alter, head clinical coach here at Progressive Rehab and Strength, with my lovely co host, as usual, Dr. Alyssa Havison. And today we are here with Eric Helms. You're not a professor, you're researching, doing research, correct?
Yeah, I'm a research fellow, so I'm not
Okay.
technically of the rank of professor in the
Gotcha.
hierarchy of academia. Yeah.
Gotcha. And bodybuilder, powerlifter, weightlifter, and prominent figure here in the strength realm. And we're not actually going down the usual rabbit hole that you go down on podcasts and interviews. We're going to talk to you about an injury and surgery that you had. So why don't you just introduce yourself, tell us a little bit about yourself, your athletic career, your professional career, and what led you into the strength sports and bodybuilding, powerlifting, and all that kind of stuff. And then we'll kind of dive into your surgery and injury history.
Absolutely. And first, just the honor to be talked to about this. Hopefully, this is helpful to people. What led me into strength sports? I started lifting in 2004. And my personality is such that I kind of put my everything into the thing I'm doing at any given time. So very quickly, it became, I should probably become a personal trainer. I wonder if I can compete in this. Let me see if I can read about this. Let me see if I can study this. And to say I was bit by the iron bug is probably a gross under exaggeration. It's more like I was converted by the Borg, if you're a Star Trek fan of lifting, and I started to become lifting and part of the hive mind. So I did my first powerlifting meet, unsanctioned push-pull in '06, and I started competing in natural bodybuilding in '07. First got into weightlifting when I decided that I wanted to pursue this intellectually as an academic in 2011, before I came out to where I live now in New Zealand, because I wanted to have a better, more complete, I guess you could say, understanding of strength and conditioning, since that's technically what my PhD was in. And found that was pretty cool too. Terrible at it, but it was pretty cool. And even got the opportunity to dabble a bit with strongman training in, I think that was like 2019, where I really gave it a fair shake and did actually some competitions. So I've competed in something like more than 20 powerlifting and weightlifting meets, most of those being powerlifting meets. I've done four seasons of competitive bodybuilding, doing, I think, double-digit numbers of shows, and a couple of strongman competitions. So I very much still see myself as an athlete, and enjoy at the core center everything I do, even though I'm a sports scientist, I'm a coach, I'm a consultant, I'm a science communicator as it relates to this, the Iron Game. But at the core of it all, I'm still an athlete myself, and I just love lifting. So it's kind of how I express myself. It's my intellectual, artistic, dare I say, spiritual expression. So it's a big deal for me.
No,
Um,
I agree with the whole spiritual thing. Not going to share my actual raised religion, but I feel like, for my husband and I, who come from different religious backgrounds, we meet. Um, this is our religion,
mm,
this is where we meet. And I definitely, it's not an understatement. It does become a religion for a lot of people. So
100%. And I think people who get that know where I'm coming from. And if you don't, that's fine. It probably just means you have a better relationship with lifting than I do. So so yeah. So that's kind of my big picture background. If there's more detail you think people would benefit from hearing, I'd be happy to give it on any specific topic.
No, I
But
mean, I think that does the one thing I actually do want to ask you before. So in 2004, when you got into this kind of stuff, what were you doing before that? Like, what was your athletic history like in elementary school, high school, college, all
mm,
that kind of stuff?
good question. Yeah. So I was in the Air Force when I started lifting. So as a kid, I went, through school, then out of high school, I enlisted in the Air Force. So I was reasonably active. I Nothing crazy, man. I love video games too, but I ran track in high school. I did martial arts growing up until I was 12, 12 or 13, 14. Um, but yeah, the thing that I probably put the most effort and time into in a more structured environment, I was a 400-meter runner in high school. So I did that from freshman to senior year, and then in the Air Force, um, they keep you reasonably active. You have to do running and push-ups and sit-ups. And then in '04, I still had a year left in the Air Force, and that's when I started lifting.
Okay. So how did you get into, well, you explained that in terms of your career and diving into the academic aspect of it. But so tell us a little bit about, you know, the injury that you experienced that led into surgery. And had you
Yeah.
ever experienced injuries? I mean, I'm sure you've had, obviously, like, we can't run away from injuries, so I'm sure it wasn't your first
Mm.
injury, but this was pretty significant injury. So tell us a little bit about that.
Yeah, so my hip injury was my only injury that resulted in surgery, so it's unique in that way, but it was not my first injury. Um, I had pretty significant back injuries that just put me in a position where I was in pain and limited in what I could do for, oh geez, like almost a full year. That was in '07. And it recurred a few times, but never that bad as when it first happened. Um, '09, I tore my left hamstring. Um, during deadlifts, during contest preps. I was also doing like it was during the hit craze where we thought
Mm.
like we were massive advantage from doing like these 15-second sprints versus just slow, cardio. And the main advantage is that you're more likely to tear your hamstring when you do deadlifts the next day. Um, so, um,
Lesson
and this is
learned. Let's not do
yeah,
cardio.
exactly. No cardio. It's terrible for you. You will tear your hamstring every time. Um, no, just kidding. But so yeah, let's see. I torn my hamstring in '09, and I had some little, the tendonitis or the muscle strains that are part and parcel of lifting for any more than a few years. But 2011 actually is when I first got the hint of this called an injury, but I think there is probably I want to say degenerative, but that almost sounds like it's like arthritis or something. But it's the continued formation of morphology in my hips that led to needing surgery and
Hmm.
possibly my labral tears. So 2011, I felt a little pain in one of my hips while squatting after I'd finished the bodybuilding season. I didn't hear any noise this time, but it was kind of like this little ouchie at the bottom of the squat, and it felt like it was right where my TFL is. At the
Hmm.
time, I didn't think it could be something internal. I was just like, oh, did I strain my TFL? And
Hmm.
I was like, I don't know if that's a thing. Like, do people strain their TFL? Um, and I just noticed that I lost a little bit of range in my squat on my right side and in
Hmm.
my hip.
Hmm.
But it wasn't so much that I couldn't hit depth. Um, and ultimately, it was not a range of motion I needed to access. So I kind of just didn't care.
Hmm.
It didn't bother me on hack squat, leg press, any of my bodybuilding movements, and it didn't bother me on squats. And I just kind of had to take some time off, but it got better, and I was back to it. But I did notice from that point on, I'd always had slightly reduced range of motion on my right hip. It's 2011 is a long time ago. Um, and then it was pretty much not a problem until I started getting into Olympic weightlifting. Um, and like the person I just tend to be, I didn't want to not power lift while doing Olympic weightlifting. So I figured I would just train for both simultaneously. So I was doing, cleans, snatches, as well as heavy low bar squats in the same week. And this seemed to just aggravate and then accelerate the issue that I noticed that wasn't really an issue in 2011. So for the first time, I was actually accessing a range that now was more my end range of motion, at least on my right side. Um, and I noticed that seemingly in combination with heavy low bar squats, or then I was being in a greater hip angle, was putting me in a position where my hips were not always happy with me. Um, and I want to say it was in 2013 where I had a similar feeling to that 2011 moment. but I actually heard something or I felt something. It's tough to say when it's inside your own body whether you actually heard it or not. And it felt like a little like pop in my hip in a deep position. And basically, the same thing happened as last time, but the range of motion decreased even more.
Mm.
Um, and I also decided that I could train around it and train through it, which, in not even in retrospect, at the time I knew was a bad idea, but I did it anyway because I was young and I had nationals coming up. I had Auckland champs coming up, and then I had Commonwealth champs coming up. So this was an era of powerlifting where I was actually not terrible relative to everyone else, so I could actually make the B team for New Zealand. Um, then everyone got good, but nonetheless, I had my glory days where I was an international IPF competitor for 1 year. But my squat went from, I want to say, should I speak in pounds? Is that better for your listeners?
Probably pounds, but kilos is fine too.
Okay, yeah. So I was in the like 490-ish at
Mm-hmm.
my first comp, and then each comp it dropped by like 10 to 15 pounds, and
Mm.
then by Commonwealth, so going from April to I want to say July would probably would have been nationals, and then November where Commonwealth was, I had gone from a 490 squat to like a 460 squat. So I was, you know how you're supposed to peak and your
Yep.
performance goes up.
That's not
I
the
was
progression we want to
No.
see.
right. No, I was downhill skiing into the comp.
Yeah, and
So
just like before we even get into like what led you into surgery, these are the kinds of things that we look for when we're trying to help someone decide to have surgery or not. Is like, are you stagnant? Are you progressing? Are you getting worse? Just like in combination with the management that you're already trying to do, or the changes that you've already made to address the issues. So definitely like that's a red flag for us that like maybe we need to do something more about this, than just work around it. So anyway, keep going.
no, yeah, that's and to see, like I said, to some degree I knew better, but what I was doing at the time was essentially physio. I was seeing a physiotherapist, which is basically a PT for those in the States, and trying to do everything except like take time off because I was had this big comp coming up, um, and modifying movements to some degree. But that really started to come after this year, where I just saw my squat, plummet is probably it emotionally felt like it was plummeting, even though it was, it's still up there. But it wasn't, it was certainly, a notable decrease. I was able to preserve my deadlift strength. It didn't get better.
Mhm.
Um, and, the bench was unaffected. But, but yeah, my overall performance was going down. And more importantly, I was in constant pain. Um, and the only way I could seem to alleviate that pain was just not going to depth, um, and not doing the Olympic lifts. So it was emotionally challenging. So it just felt like, all right, so all this stuff's off the table for me unless I figure out some way around it. And then
Did you have pain outside of training too, or it was just with squatting?
eventually it did start to give me pain out of training. And it always seemed related to the fact that I had squatted or had done a clean and caught it too low or something like that. So yeah, it did become something that I felt like at night when I was asleep or getting in and out of the car, um, on the toilet, for little TMI for the listener.
No, I mean,
Um,
people don't talk about those things, but low back and hip issues can affect bathroom habits, dressing
mm,
yourself, and intercourse with your partner. So, and people don't talk about that, but these are things that, you have to think about when you're like looking at how an injury is affecting your function. Is it like, do you not care about that stuff? And like, as long as
mm,
you can train with, and that stuff's affected, then you're fine. Or your training is fine, but those things are affected. Are you okay with that? Or, like, so
yeah,
people just don't talk about it, but it's pretty much everyone that has a hip issue. They don't talk about it, but they got those issues too.
yeah, yeah, and I had some of those for sure. Um, and so long as I wore the adult diaper, and I told my wife, look, once I get the hip surgery, we can start to be intimate again, but I just got to keep training. She was fine with it. So
At least she was
Um,
understanding.
yeah, I mean, she left me, but I think she was fine with it at the time. Yeah. So
Guys, he's kidding. They're not. They're
but
still together.
we are still together. Neither one of those things were true, but I couldn't help myself. Um, I'm an idiot. Yeah, so like I did have some trouble with sitting down onto the toilet, just to be 100% serious, and it sometimes would wake me up at night,
Mhm.
and that had to do with the proximity to training,
Mhm.
and then getting in and out of my car, which just happened to have at the time was like this kind of low seat,
Mhm.
and yeah, then I after the 2013 Commonwealth champs, I was like, all right, well, I'm like that was that was a big comp, and I did that knowingly going into it. I made a decision to be a little more clear. It wasn't just like, "Fuck it, I'm gonna train through it." It was more like, "All right, let's get through this season, and then
Mhm.
we'll do something different than what seems to not be working."
Mhm.
Um, and that was when I was like, "All right, let's just see what I can do with training modifications to where I don't go to depth." Um, And interestingly enough, at the time, I found that the Olympic lifts were not so much of a problem. It seemed to be the low bar squatting that really was the biggest issue.
Interesting.
Um, so I could front squat to depth.
Mhm.
It wasn't to the depth that I would just naturally do a front squat. But because the back angle was less and therefore the hip angle was less, I could get to about uh, competition depth on a front squat, but I would normally squat a little deeper. So I just had to cut my cleans a little short.
Mhm.
Snatches, the load was low enough that it didn't seem to
Mhm.
be an issue.
Mhm.
But low bar squats, I would know it would cause me issues immediately.
Mhm.
Um, and my pain was such that I would get some hip pain, but most of the time it was my like contralateral lumbar to the hip that was the most
Mhm.
problematic.
Mhm. Probably because you were like shifting away just a little bit and getting some twisting. So it's interesting because, and this is so the injury that you have. Let's let the listeners know what we're dealing with here. So you
Mm.
had femoral acetabular impingement and a labrum tear on both sides.
That was the question, and that I did not understand that it started to feel like it was both sides,
Mm-hmm.
but I was much more symptomatic on my right hip,
Mm-hmm.
and I can't I'm failing to remember because I got the surgery 6 years ago, and as you can tell, we're not at 6 years ago. It's not 2014 or 2013, so there was a gap between
Right.
when I had this issue, when I had surgery, and then to
Mm-hmm.
now. So
Mm-hmm.
I don't ever think I remember getting what I suspect was the labral tear on the other side.
Mm-hmm.
I think that pop in that moment where then it got bad in 2013, maybe even 2011, were labral tears.
Mm-hmm.
Um, but to fast forward, when I actually had the surgeon go in and do the bilateral surgery, he was like, "Dude, your other labrum was even more messed up than the one you had pain on."
Well,
Um,
and that, we can go down the rabbit hole. We have podcasts on this, but that's why,
mm,
imaging, we can't just go by imaging alone or understand or say like, well, I have this in my hip, so that's why
mm,
I'm injured, because you can have a totally shredded labrum and not even know that you have anything going on in there.
yeah.
Um, so what was my question going to be? When did you actually go to the doctor and get a diagnosis?
Pretty early on. So I did go to a physio who can, you know, do diagnosis. And then I got a referral to a surgeon, an orthopedic surgeon, Dr. Matt Brick, who
Mm-hmm.
actually is just like two stories down from where I work at AUT,
Oh,
and he
cool.
is the like preeminent hip guy
Mm-hmm.
in Australasia and Oceania. And in the weightlifting club where I was training, there were two at the time, two or three, but eventually there was five other high level lifters who had gotten hip surgery. Most of them very successfully, which is why I was interested. One of them, Tracy Lambrix, then went on to compete in at Rio, the
Mm-hmm.
2016, I think was Rio, or no, that was UK, London. She went on to compete in the Olympics as a
Mm-hmm.
Olympic weightlifter. So I was like, okay, this is not a death sentence, and
Right.
this is probably worth pursuing. But I was still like, I wasn't in any rush to get hip surgery. Um, like, I didn't think so. I did. So I'm me. I'm a sports science researcher. So the first thing I do is I read everything there is to read about FAI
Right, right.
prevalence and the efficacy of surgery. And
Mhm.
it's better than some of the other sites from the data I read as far as the efficacy of surgery and what people report afterwards. Um, but it wasn't good. Like there was similar
Long-term
overall,
outcomes.
yeah, similar long-term
Yeah.
outcomes to people who did or did not pursue
Right.
surgery.
Mhm.
And the take I got was that, maybe this is being overprescribed as a solution. But it did seem like there were opinions, and from talking to the surgeon, that certain people are a better fit for it than others, and you need
Mhm.
to really know what you're doing on the front end. So I was reasonably confident that Dr. Brick, would give me a good diagnosis. They do it with live X-ray when they do the surgery. They do some manual testing and then also imaging in combination with imaging with dye. So it was a pretty intensive procedure to actually get diagnosed.
Mhm.
Um, so I got MRI, I got X-ray, I got clinical testing, and they asked me a ton about, kind of like we're doing, about what my experiences were like,
Mhm.
to get an idea of whether I was a good candidate for it. And the funny thing is that we did that, and then I waited like 3 more years to get the surgery. So I kind of had to get like rechecked up again, obviously,
Mhm.
since 3 years had passed. Um,
So why didn't you have the surgery for 3 years after going through all of that?
Good question. Few reasons. So one was financial, and that just had to do with the fact that it wasn't. I didn't become like financially stable until I wrote my books,
Mhm.
and
Which we
uh,
have. They're
oh,
sitting over
thank
there.
you.
Yeah.
Honored to hear it. Well, those books paid for my surgery, so
Awesome.
um,
Glad we could support it.
yeah, you did. So in New Zealand, they have an awesome healthcare coverage system that is kind of a blended approach to privatized and public.
Mhm.
And the main way that they do public healthcare is through what's called ACC. And ACC is something everybody pays into, and it deals with like accidents and acute
Mhm.
stuff.
Mhm.
So I did actually apply to ACC to see if they would, you know, they would take care of the FAI, and there's levels of scrutiny. So
Mhm.
once you're going, hey, I'd like to get a $30,000 surgery, that's when there's a higher level of scrutiny. Once you're saying, hey, I'd like to, go to the physiotherapist's office, they're like, whatever, white stamp it and rubber stamp it. I don't know if it's the same. So that's yeah. So the physio was no problem. When I said, "Hey, I'd like to get this massive surgery," they had a panel of medical professionals look at it, and they said, "Look, this is not an acute injury that we're
Right.
dealing with. It doesn't fall under ACC." And then I said, "No problem. I have health insurance through AUT University." And I, like an idiot, applied for this when I was between my master's and my PhD, so I was in an uncovered gap, and that's forever where this injury must had to be, and was seen by the insurance companies, and I could not try to do it.
Unapply originally.
Correct. I was like, just kidding, give me a month, you know.
It didn't
Um,
happen. It didn't happen yet.
yeah, I'm fine.
Ugh.
So I was in a position where I had to pay out of pocket, so that was part of it, um,
Well,
but not
I
all of it.
wanna just take a moment to talk there because part of the reason we're doing this podcast interview in this series is to bring these issues that
Mhm.
people have to light, because these are the things that people don't talk about. And
Yeah.
depending on where you are in the world and what type of insurance you have and medical providers and all that kind of stuff, um, it's not we take insurance for granted, and people don't often realize how much out of pocket expenses there are with surgeries. Even if you have great insurance, there's still deductibles. There's you need pre-authorization. They look at medical necessity versus elective, and all that kind of stuff. And then even if the doctor is under your insurance, the anesthesiologist from the hospital might not be under your insurance. And there's all these factors that go into how much a surgery costs. And people often don't understand that. And then here in the United States, they're not good at explaining that. Doctors' offices are not good at explaining that. People don't even know to ask those questions. And then they get these fat bills after surgery that they can't cover, or they can't have the surgery because they don't have the funds, even though they pay high premiums for insurance. They still have a $10,000 deductible that they have to
Yeah.
meet. So the surgery is still going to cost them $10,000 no matter what, or the good doctors are out of network and that kind of thing. So it is an extremely high cost if you don't have full coverage. So when it is elective and when it is non-traumatic and when it is more of a chronic thing that isn't affecting your health status, then we kind of have to make these decisions. Do I have to have the surgery or can I wait? And like, what can I do?
Mhm. Yeah. So that was one reason. And the other aspect was that the modifications and the ability to train around it that I did in 2015 and 2016 and 2014 worked in some ways.
Mm-hmm.
Um, I was able to get my squat back up to 490,
Mm-hmm.
uh, just by doing front squats, um, reduced range of motion squats, and a bunch of accessory work. Um, and I was de-emphasizing Olympic weightlifting. I basically wasn't doing it anymore, and I was motivated by that year, even though I didn't have a great year of competing at Commonwealth champs. Of like, oh, let's see how far I can take this powerlifting thing, and so I still had a competitive outlet, um, and I was enjoying it. But my squat plateaued. It got right back to the PR I had pre hip getting really bad, and just stayed there. And I couldn't move the needle. Um, and without having pain, basically.
Mm-hmm.
The amount of work that I needed to do specifically on squats to move my squat up was also the amount that would move my squat down.
Mm-hmm.
So I
Mm-hmm.
was kind of stuck between a rock and a hard place, or a labrum and a bone spur, and um, and I found basically if I squatted heavy to depth, that I knew the consequences. So I actually pushed it to the point where I was literally only squatting for competition in the 2 weeks prior, where I would squat maybe 2 to 3 times, actual to depth squats,
Mm-hmm.
just to kind of get that motor pattern groove.
Mm-hmm.
And I knew that I could get maybe 3, 4, 5 reps in each one of those like squat sessions total before it would cause issues that lingered, where pain would flare up and then I wouldn't be able to perform. So if you wanted to figure out how many squats I did in 2014, 15, or 16, you just take
Just
the
look
number
at
of
number of
competitions I
competitions.
did and multiply it by about 5 or something like that. But everything else was heavy walkouts, partial squats, front squats, lunge, leg press, hack squat, you name it, other stuff that I could do, and letting my deadlift kind of take the lead in my powerlifting sessions.
Out
Um,
of curiosity, were you successfully hitting depth on all of your competition squats?
One hip was, which is all you
Okay.
need to get
All you
two
need.
white
Yeah.
lights.
Yep.
No, I was legitimately. So that's actually the thing that I pushed me over the edge is I would sometimes get injured in competition, or what would
Mm-hmm.
feel like a re-injury or re-aggravation
Mm-hmm.
of the issue because um, I remember at nationals in 2015 I didn't hit depth on my first 2 squats, and I just had to bury it on my last one, like bomb out, and that messed up my hips.
Mm-hmm.
And I was like limping for the days afterwards, and I got 2 whites on that one that I buried, right?
Right.
So it got to the point where I knew that the bottom of my squat, where I would be getting at least 2 whites, was the end range of motion that I could physically get to. And like you said, Roy, there was hip shift, so I was kind of like had this like torsion in the bottom of my squat, and I would always get one red light on my non-symptomatic side, right, or my symptomatic side. Um, so I was like 2 white lights for a long time to hit depth, and occasionally, if I had like slightly more strict judging, or I don't know, maybe I was tighter that day, then I would only be getting one white light from the head judge. So that was like, okay, is this getting worse? I don't know, but it's certainly a problem.
Mm-hmm.
So yeah, I couldn't. I think for me, the biggest thing that was frustrating me is I just couldn't move my squat forward. So um, so I was like, look, like if there's a chance that I could progress if I got this surgery again, then I should do it. I'm not getting any younger. Let's pull the trigger.
Speaking of, how old are you, if you don't mind us asking?
No, not at all. So I'm turning 40 in April,
Okay.
and at the time I was in my mid 30s.
Okay.
Yeah.
So, yeah. I mean, we kind of, our athletic peaks are between like, especially in the sport, are between like 25 and 30, you know, so 25 to 35. So definitely for people who are listening, you know, it's harder to get stronger the older you get. And if you're battling these types of things and not getting stronger, but you're trying to get stronger, you know, you got to kind of think about like, are you getting stronger or weaker if you're just kind of staying there? So definitely gets harder even without injuries. So at that point, you decided it was time for surgery.
I did, yeah. So that would have been, I think, 2016. I contacted Dr. Brick again. I said, "Hey, do you remember the consult we had 3 years ago?" And he's like, "Nope." I was like, "That's okay. Let's do another one." He's like, "I do 100 surgeries a year, so or probably more." And so I was able to get on the list. And because I had already been in once, I was able to jump the massive line to some degree.
Mm-hmm.
And yeah, reassessed. Things were essentially the same. Just because the modifications I'd made, I said it kind of worked. I got back with my old squat, and then I was able to train around it and maintain it, and basically not have symptoms in life.
Mm-hmm.
So I distinctly remember in my second consult, um, Dr. Brick was like, "So this is kind of like an elective surgery, just so you can try to squat over 500 pounds." And I was like, "Pretty much, yeah." Like, I'm fine now. Like, I figured out how to work around this. It's train in such a way I could hang around 490, but yeah, this surgery is for me to get the extra 10 pounds. Um,
So it's interesting
so
because
yeah,
we spoke to an athlete whose interview is coming out before yours on the podcast. So Chelsea Sabat, and her reason for having the surgery was because she was in excruciating, debilitating pain. Versus yours was you were working around it, you were able to train, but you just weren't able to get stronger and exceed. You kind of just like flatlining for years with your squat. So,
yes,
I mean, obviously you had pain and symptoms if you went into those ranges and trained at the capacity that you need. Like you would have been symptomatic if you were training at the capacity that you needed to progress. And that's like where Chelsea was, is that she was, just chasing those numbers, and she was ignoring not like ignoring the symptoms, but she was accepting the symptoms to push
mhm,
her training and get to the next level and qualify and keep going. And for you, is like, let me get out of pain, but I'm sacrificing my progression.
that's I think very well said. Is that I was not willing to do another 2013.
Mm-hmm.
It wasn't worth it for me, and it just wasn't working because
Mm-hmm.
I wasn't like it's a good thing my squat went down going into Commonwealth. Let's say it that way,
Mm-hmm.
because if I had been able to progress while being in worse pain,
Mm-hmm.
I probably would have made that deal with the devil for a while,
Right.
to my own detriment, long
Mm-hmm.
term, perhaps.
Mm-hmm. Mm-hmm.
So yeah, it worked out that that what I was doing and what I could do, seemingly to the capability and the knowledge I had at the time, was insufficient to get both. I couldn't like progress and be in pain. I could either stay stagnant and not be in pain, or be in pain and then backslide. So it was a relatively straightforward decision, and I was able to, like, if I had just decided, you know what, I'm just going to bodybuild, I might still not have gotten the surgery.
Right.
Um, I don't know if that would have resulted in long-term hip issues. One of the things that my surgeon said afterwards, having repaired both labrums and dealt with that, is like, you might have needed a hip replacement in your 50s, based upon this. And of course, he doesn't have a crystal ball. That may or may not be true. That's the perspective of the surgeon.
Yep.
And but if that happens to be the case, then I made a good decision because I don't want a hip replacement in my 50s.
Right. Yeah.
Yeah.
So tell us about your expectations going into the surgery. Um, and how did what you experienced after the surgery differ, if
Mm.
they differed from what you expected going into the surgery?
You know, I had high expectations going into the surgery. Dr. Brick is very confident and very experienced, and I had seen, I want to say, 5 out of 6 of the athletes at North Sport have a very good experience with surgery, and the one person who hadn't jumped into training too early knew it, and that's what they also would self-identify as why it went poorly. Um, so I had I'm going to follow the rules. I'm going to be a good soldier. I'm going to do what I'm supposed to do, and I'm going to take it easy. And I'm in no rush. the main thing I want is for this to be successful so I can have a foundation to build on top of. Um, the one thing that I did not expect, that eh, the one acute thing I did not expect that surprised me, that I did not like, is I had a really rough time with being put under and waking up. Like I had like it was just awful. Like um I didn't think that was going to be a thing. Like, oh, you go to sleep, you wake up, but it took me like hours to feel not like I wanted to rip my skin off. Like I just felt terrible after waking up.
Some
gets that
people don't
after.
respond well to general anesthesia, and I'm one of them. I'm in hysterics for like
Yeah.
at least 24 hours when I wake up. It's really not. It's not pretty.
Yeah,
It's
that
like
sounds 24 hours sounds worse than I had it, but I've never been so uncomfortable in my life, and it lasted 3 hours, and then after that I was still really uncomfortable. It just wasn't the worst discomfort I'd ever been in my life. And I was like, if you'd asked me today, like, would you go get the surgery again? I would be like, I don't know, man. That was a really
You're like,
shitty
do I want to?
experience.
Yeah, do I want to deal with
Yeah.
that? I had
some people
wrist.
love anesthesia. Like they wake up, they're like, oh, it was like a nice
No, my
Nope.
God, I had wrist
nap.
surgery while I was in PT school because I needed to use my hands, and I had, like if I didn't have the surgery, I wouldn't have been a great physical therapist for a bit. Now I don't use my hands. Don't put my hands on people. We don't do manual therapy anymore, but back then I did. But oh my God, I was like hallucinating after the surgery. It was like my husband was driving me home, and I like thought he hit a kid on a bike. It was like so bad. But then I was like fine the next day, but like not good for it was terrible. And then my little son just went under had surgery on his ears, and he woke up and he was like totally fine. But he
Good.
was only under for like 5 minutes. So it's probably also related to how long you're under. Do you know how long your surgery was?
Yeah, so I was under a while. It was
Yeah.
most of a day.
You
Um,
had 2 hips done, so
yeah, I did them simultaneously. What had been done, I think I was the second person that Matt did 2 hips at the same time. The other person actually was my buddy Ricky Lindsay, and he
Mhm.
actually he placed second at weightlifting nationals.
Mhm.
And then he went and got his hip surgery, or no, he got his hip surgery and then came back to play second at weightlifting nationals. And he was the first person that Dr. Brick did bilateral, same time. And that was actually something else that was making me kick the can down the road. I didn't want
Mhm.
to go through 2 recovery periods.
Right.
But they were like, well, you need to be putting, like, there was concerns at the time 8 years ago as to the issues with doing them at the same time. Were the pros and cons worth it?
Mhm.
But once he had a really good experience, and I trained with him every day. He was a friend of mine. We was doing
Mhm.
his master's while I was doing my PhD, and he shared his experience. Um, I was a lot more confident to do it, and so was Dr. Brick, and it became a thing.
Mhm.
So I was under, yeah, I want to say like 4 or 5 hours.
Yeah, that's a long time to be
Um,
under, so it can definitely make the the amount of anesthesia that's in your system, the
mm,
can, just the amount of time it takes to get out of your system also can lead to that kind of terrible experience when you wake up. Um how was the your function and like because a lot of people like surgeons don't, and you had done a lot of research yourself, and you had spoken with the surgeon a couple of times. You also knew a handful of people that worked with this surgeon and had this type of surgery, so you kind of had you had an understanding of like, okay, the first week and the first couple of weeks, this is what it's going to be like. So but a lot of people don't, and surgeons
mm,
in our experience do not educate people on what to expect immediately post-op, and what that feels like and how long they're going to need help for, or what type of help they're going to need, or like how long they're going to have to be off work, or not even going to feel like sitting on the couch is hard, so
Or any restrictions or precautions that they have to follow. Did
so
your surgeon give you that information? Did you know what to expect?
yes. So they did a good job with that. They wanted me basically cycling almost immediately on a regular basis. Um, and there was a time period where I was taking NSAIDs to prevent any possible regrowth of bone, which can sometimes happen in the acute
mhm.
phase. And I was coming off that, and then I had basically a bunch of exercises which were uh, Pilates physio style exercises. I ended up going off script in consultation with
Mhm.
my surgeon, not just
Mhm.
I know what I'm doing. I'm
Right.
and not like that, but yeah. So I got this packet of information. I had some checkups, and I was regularly seen. I was doing cycling to start. The After that, I was supposed to not do any like vertical loading for 4 weeks with like a barbell. Um, I was given crutches initially, and I was basically told, "Hey, once you think you don't need the crutches, ditch them." So that was like a day. Um, and uh, Actually, I stayed on 'em an extra day longer than I needed to, and I asked him like, "Should I be staying on these for a certain amount of time?" He was like, "No, you still on the crutches? Do you need them? No, you're fine." So I jumped off them pretty quick. Um, and the exercises that I was supposed to do was basically like, "Hey, take a week off training completely. Just let your body recover, and then you can get into upper body training. Just no vertical loading, and then eventually you can start doing partial range of motion, squat and hinge patterns." And I was like, "So, question about that," and that's where it started. I became that patient, and
We like those. We like
I
them. Doctors, people, a lot of doctors don't like those, but we like those.
to Matt Brick's credit, I was texting him and he was hitting me back quickly, and he was like, "Oh, that's a good point." So I'm obviously the rare, you know, participant of this type of thing where you're studying sports science, and I was like, "So what are we trying to avoid here?" And talking me through and I'm like, "So there'd be no issue with me doing like a leg extension or a leg curl." And he's like, "Yeah, I guess technically not."
Hmm.
And then I was like, "What do you think about at the 4 week mark, me doing like just partial range hip thrusts, so it's not vertically loaded with like a sandbag,
Hmm.
like one of those 10 kilo
Hmm.
kind of functional fitness sandbags?" He's like, "Yeah, I guess that'd be fine too, so long as there's no pain." And he was like, but I went in sideways. Like I have these like little
Yeah.
three kind of like it looks like where the predator zaps you if you guys like 80s action movies, just like on both sides of my hips. So it didn't bother the surgical sites early on. So I was doing very early on, like in week 2, I was doing leg extension, leg curl, seated calf raises, and hip thrusts with relatively light weights. Um,
Now, did you
and
experience any pain or discomfort during this time?
yes, yeah.
So, share
So
with us a little bit about that because people often fear pain. And
mm,
they're like, pain is bad. If I feel pain, I can't do it. And, in the rehab process, post op, things hurt. So,
yes,
talk to us a little bit about the pain that you were experiencing and, what was like a red flag for you and what was like, okay, keep going kind of thing.
yeah. I asked. That was, I think, so. Overall, my expectations were met, but they were intellectually met, but there's no way to understand what you'll be experiencing unless you've experienced it before. So this is my one and only hip surgery, hopefully. And the the type of pain when it happened, the movements that led to it, the severity, and my story that I told about what did that pain mean when it would come up were not what I expected. So I had this kind of like this dull ache in both hips because I'd been, cut open and they ground around on my, like repaired, like deflossed this labrum, shaved off part of my bone, and then moved me while I'm unconscious into like these crazy
Mm.
deep squat positions. Don't ever watch the video of what they do to you in surgery
Even when the
beforehand.
doctors tell you that it's, I mean, a labrum tear, a labrum repair, and the shaving of the bones and stuff like that's not a simple surgery. It's not, and
Mm,
although it is arthroscopic, you didn't have
yep.
an open hip repair. So when surgeons, and if this is, I think, like a language thing, um, they to them it's like, oh yeah, it's non-invasive, it's arthroscopic, and when it's not these repairs or bone shavings, or it's just like a knee scope or something, they're like, oh yeah, it's simple. But you don't realize that they're putting your body into ranges that you never go into. And so your tissues surrounding the joints, your muscles surrounding the joints are like totally shocked when you wake up. And they literally go in and, like what you said, there's like this going on in your joint. Like, when did we ever do that inside of our joints? So people wake up and they're like, why am I in so much pain? Like,
Mm.
why am I aching? Like, what is this? I didn't have this before the surgery, kind of thing. And I think that's something that like a lot of people don't expect because they don't realize.
If people did watch the video of the surgeries, they would understand why they feel the way they do.
This is true.
What's happening when you're asleep?
Exactly. It's pretty wild.
Yeah.
And like you're like naked and unconscious, so it's like
And there's like
just
6
kind of
people around you.
yeah,
It's like-
thinking about like that doesn't happen to real people. That's just information. It's kind of have to put that away somewhere to make it okay. So anyway, yeah. So I had this kind of ache that subsided on a kind of a normal time course of weeks. But then I would have these occasional sharp pains that I could not really anticipate, depending upon whether I forgot how I could or couldn't move at any given time during the course of my recovery. And those sharp pains were scary. Like the first time it happened, I was like, did I just dislodge like an anchor or something? Like what the fuck, And I texted my doc and he's like, look, nothing's moving in there. You can be in pain and you can, create some inflammation, but you're not gonna. I'd be more worried about you not moving. Like if you weren't doing the cycling, we could get some, tissue kind of adhesing to itself. So stay moving, but let pain be your guide was kind of the guidance. And for me, the thing that was the slowest to come back without being painful was lateral movement. So external rotation and abduction of my hip would, because I'd feel fine, like I'd be totally good in the sagittal plane, thinking I'm fine because I'm pretty sagittal guy. Like I'm just walking around. I don't play like tennis or anything like that. And then I would do something that required me to do that, and it would be like someone stabbed me in the hip real quick, or I'd have a dream and I'd twitch and I would yelp and wake my wife up and wake myself up. And I'm like, who screamed? She's like, you did. What the fuck,
So it's
yeah.
interesting. We mentioned the diagnosis you had and the surgery you had, but with femoral acetabular impingement, so that's a bony. So we have 2 bones in the hip. We have the femur and we have the acetabulum. So the acetabulum is the socket. So this is for people who aren't. And on the YouTube video we'll put images of this stuff. So the acetabulum is the socket, and it's like kind of like half of a ball, if that, it's like a dome kind of thing. And then we have the femur, which has the like long bone portion, and then there's a neck of the femur angled in with a ball that sits in the socket. And the type of so with femoral acetabular impingement, there's 2 types. And it involves overgrowth of one of the bones of the femur, one of the bones of the hip. And that pinching or discomfort that people feel with femoral acetabular impingement is really this like bone approximation. So that bony overgrowth, whether it's impinging on itself on the bones that it's approximating, or on the tissues around the joint, the ligaments, the joint capsule, or even muscle. So you had, to my recollection, you had cam impingement, correct?
Yep.
So cam impingement is bony overgrowth of the femur, and pincer impingement is bony overgrowth of the socket. So typically with cam impingement, in my like clinical experience, people get more like lateral pain, and with pincer impingement, people tend to get more anterolateral. So it's still lateral, but it's more in front of the hip versus the lateral aspect of the hip. So when we externally rotate and abduct, we're kind of putting the femur in that where that bony overgrowth is impinging on the acetabulum. And also, and this is how I like to describe bone pain. So FAI is oftentimes like this like bone experience. It's like a sore tooth. If you can not visualize, if you can feel that, like what a sore tooth feels like, or kind of like a visualization or audio sensory type experience would be, do you know the game Operation?
Yeah.
So a lot of people describe FAI pain as like when you hit the side of the operation thing, right? When you're going in and it's like, oh, so it's like you're fine in all these ranges, but as soon as you go into that range where that bony overgrowth is, it's like that's where I'm experiencing. That's like, oh shit, that's like bone shocking kind of. So it's like when you get kicked in the shin, that kind of bone discomfort. And to everyone, it's like there's a varying degree of that, but in the healing process, so bone takes about 8 to 12 weeks to fully heal without like kind of having pain. So I wouldn't be shocked, pun intended, if the symptoms that you were experiencing were just kind of where that bone was healing from the surgery. And then we're getting like there is bone regrowth because they shave some of it off, and then our bone has to kind of heal and fill in that spot. So um, long-winded interruption too with that symptom that you were experiencing post-op.
No, thank you for that. It contextualizes, I think, what my experiences were, and yeah, I was very happy with the rehab period on the whole, even though there were those like, oh shit, text the doctor moments,
Mm-hmm.
or those little surprise pains.
I mean, but there always will, and I think that's part of the reason why we're sharing this story is because people expect rehab to be linear.
Mm,
And you see those like infographics or those images on Instagram where it's like what people expect rehab to look like, and it's a straight line, and like or what rehab actually looks like, and it's like all this like scribble.
mm,
And the same thing is like it's the same thing with our training and our progress after kind of that like novice period where things are linear. And then you get into intermediate and advanced, and it's like a scribble. But as long as the scribble is moving up,
yeah,
then we're moving in the right direction. So
exactly. And mine was, as linear as real life can be. I was actually really pleased. I basically the kind of the few bullet points along the way were, yeah, at the 4 week mark I could start putting stuff on my the 4 or 6 week. I'm not recalling perfectly. I could vertically load, but I could only go to like a 45-degree hip angle. I can't remember the specific hip angle, but it was a hip angle where I could actually do a conventional deadlift, just because of my limb proportions and height. I couldn't squat all the way down, so I was doing partial squats, primarily doing leg extension, leg curl. But once I could start deadlifting, now I'm having fun again. And I was very cautious, of course. I think I started with just 40 kilos, um, 88 pounds. So that's just the right size bumper because I was training in an Olympic
mm-hmm.
weightlifting gym, but light weights. And I was adding basically 5 kilos a week and just doing, working up to a couple sets of five, a couple sets of five. And I just kind of built from there. And eventually I just like, I feel like I'm holding back my progress more than my body needs me to. And I started jumping much larger weights because I'm a sumo deadlifter, but I was pulling, 560 at the time sumo, and I could probably pull, I don't know, 490 or something like that conventional. And I couldn't obviously with the amount of time off I'd taken, but at the time, but I was probably like, if I had just walked up and someone said, look, deadlift as much as you can, or I'll kill your family. Happens all the time.
I always
You
say
got to
that.
be ready for that.
I'm like,
Yeah,
if I
the
held a
mafia
gun to your
always won.
head, like I know you would be able to do that. Like
Exactly.
that's what you're lifting.
Yeah, I probably could have pulled in the low 400s just on any given day. So
Mm.
88 pounds and I wasn't in pain. I'm like, all right, I'm going to go to 135. Oh, okay, I'm going to go up to 200. So very quickly I was deadlifting in reasonable loads that were challenging. Still like RPE 5 to 7, nothing crazy. And then I think at the 12-week mark, I was cleared to basically do whatever I wanted. But I was not fully recovered. I couldn't do sumo lifts, and the low bar was still a little uncomfortable. So I was like, all right, so I'm just gonna push up my conventional and my high bar. Um, and then at the 16-week mark was when I was completely pain free. Like I could do like a sideways leg swing, and I was
Mm.
fine. I was, and my range of motion came back like better than it was in 2011.
Mm.
So I could deep squat. I was like, I'm like a 28-year-old again. This is great. It's it was amazing. I wasn't like an 18-year-old again because come on, but I was. far more mobile than I had been previously,
Mm-hmm.
and I was really pleased with the fact that I was pain free, the fact that I could train the way I wanted to, and I just started throwing in. This is also a great opportunity for me to figure out what dose of training do I actually need to progress. So I kind of wiped the
Mm-hmm.
slate clean because I had not squatted for now 12 weeks, right, at least to depth.
Well,
Uh,
I think so. We talk about something called the repeat novice effect.
mm,
And for you, I mean, yeah, you didn't squat for 12 weeks, but you also hadn't low bar squatted in years, you know,
100%.
and you hadn't squatted to depth in years.
Yep.
So you really had this unique opportunity. This is like a whole new lift for you. So
Mm,
you really had a unique opportunity to capitalize on the novice effect,
yep.
which is sometimes like for advanced lifters, I always say that this type of thing, whether it's like a layoff because of life or injury, sometimes for advanced lifters it's like a huge blessing when you get this large training interruption, because we just need more and more and more and more to progress,
Mm,
and it becomes, I think that there's a point when you're like a very, very advanced lifter where you actually need less. But most of us aren't really at that point.
mm,
And I always say like it's, and this is a perspective things that I like to have. I try to help our clients and our athletes understand is that these types of things are like forced blessings, where now you have something that you can you don't have to train for so long every day and every week, and you don't have to squat as much and you don't have to deadlift as much. So it's pretty cool seeing that kind of thing happen. But anyway, you were able to recalibrate kind of the amount of training stress that you needed.
yeah. So I had I was able to, in the period where I was knew I needed surgery but didn't get it for 3 years, I had gotten my front squat up as my kind of my main squat lift, and I got it to like 170, which is pretty good for me. That's 374, um, and
What weight
and
class are you
then
in?
I'm a 93,
93.
so
That's what, that's 205?
yeah,
No,
205. Yep,
205.
yeah. So I was, and that was like a 10 kilo improvement on 22 pound improvement on like my prior best
Mm-hmm.
front squat, even when I was Olympic weightlifting, where you do that
Mm-hmm.
a fair bit more, and it's very similar to cleans. So I was still finding ways to progress. I was still training, but you're right. I had not low bar squatted more than 15 times a year, like reps, and more if you add in the comp lifts themselves and the warm ups on the day. Um, and now I was high bar squatting, so still not low bar squatting yet post surgery at the 12-week mark. And at the 24-week mark post surgery, just with working up to a heavy single 2 to 3 times per week, and maybe doing one or two back off sets of three at like a low
Mm-hmm.
RPE, I hit a PR. So like a lifetime PR in high bar squats.
Wow.
So I hit 205, which is like 451.
Mm-hmm.
Um, and normally I can high bar squat about 10% less than my low bar squat. That's the typical ratio that I find myself kind of roughly. So I was like, oh shit, like if I can low bar squat, I'm going to be over 500 pounds pretty soon. Um, and I was, a little premature in how long it took me to get there. But long story short, I did actually hit a 500-pound squat just in 2021, and so yeah,
So that was how many years after your surgery? 4?
yes, 4 years post surgery. Might have been able to do it a little earlier, but I did a bodybuilding competition season where I'm a 93 and I get down to like 80 kilos when I compete in bodybuilding. So it's not a conducive environment for getting really strong.
But Alyssa,
Probably helped to slow you down though,
A little bit,
and like
yeah.
pump the brakes.
he's
Yeah.
supporting my theory of 1 to 1.5 times as long.
Yeah.
So I have a theory, and this is just from my clinical experience working with this population. But it takes about in my experience, it takes about 1 to 1.5 times as long as you were experiencing your symptoms and then did something about it,
Mm,
until you are at your prior level of performance or exceeding it. And so you're
there you go.
solidifying my theory here. And so did Chelsea. So in our last
There you go.
podcast. There you go. N equals 2, right?
That's all you need.
That's all I need.
And that's, as a sports scientist, you'd probably think that based upon the sample size that we have in our
Oh
research.
my God. I was actually listening to a podcast of yours the other night. It was an older one, but where you were just we have a clinical mentorship program, and we do literature reviews with our students, and we just talk about, like this is the literature that we're looking at, but like it's what can you take from it, because but anyway, that's a whole another podcast episode in and of itself, which I'm sure we might actually have one on those. But so about 4 years later, you hit a low bar squat PR. So what are some things that, well, actually, let me backtrack and here and ask you this question, because we didn't really get to this question with our last interviewee, but I think it's important. Did you have any type of identity shift during this experience? And if so, what was that?
Yeah, I think it made me question who am I if I'm not going to be doing, like squats, and how would I feel like doing bench only, or just being a bodybuilder?
Mm-hmm.
And it made me just kind of examine my own, like you said, identity as it relates to what I do and who I am. And it made me grateful that I'm a coach, a researcher, and that I'm also a multi-sport, like barbell athlete.
Mm-hmm.
Because I know that there will be a time when I'm done competing in all of it.
Mm-hmm.
Probably out of the physical inability to do so.
Mm-hmm.
So I'm talking like in my 60s or 70s. It's when I expect that I will not be doing it anymore. And maybe I don't need to be thinking about that now, 30 years prior or 20 years prior, but I do. And I think I'll be fine with that. And it was good to know that to be true, to like actually examine it with a little more, like you can only have so much of a rosy tint to your glasses when it's like a distinct actual possibility in front of you. And ironically, I think this is relevant, even though it's not specific to this injury. I had a neck injury that messed me up a lot more. Ended up, thank God, not requiring surgery, even though I was going down that route. Where just randomly overhead pressing, I had this twinge, and then the next day I could barely row a 40-pound dumbbell on one hand, and my arm was in so much discomfort that I had to have my wife drive anywhere we went somewhere together, and I would keep my arm like behind her headrest, just because the only position it was comfortable in, and by comfortable I mean less uncomfortable. And that really freaked me out, because I felt once I got imaging, and I terrible news from like an imaging perspective, which I tried to remind myself, like, the images are just images, like these things do heal. But I felt like I was walking around, and if like a bird landed on my shoulder and I got startled and be paralyzed forever, like I felt very fragile, and I felt like I can't overhead press, that's not safe. I can't squat, I can't do a bunch of stuff. And that got a lot better, but there was a point, I want to say this was like July of 2018, where I was like, what if I have to not, like, only things I can do are like some very limited bodybuilding movements? And that's kind of when I had to really kind of wrestle with some of these questions and figure out how would I do with that. And I think for me, I found that I needed some connection to the sport or the iron game broadly, that gave me a sense of contribution, meaning, competence,
Is that when
relation.
you
Like
started your podcast?
that, I started the podcast in 2019, so, or maybe or late 2018. It was a little bit after that, but it was actually when I met Omar. So I went out to Canada. We did some filming together, and he made some joke about getting in a fight with these guys who were in this restaurant, because one of them, randomly did something that could be perceived as rude or whatever. It was completely kidding, and I was like, Omar, if we got in a fight, I would do it, but if I took one punch, I'd probably be paralyzed for my life. And I told him about my injury. It was a funny conversation, but so that he knew that when I first met him. So we actually had some discussions about that, and I think it did tie into some of the themes of iron culture. But anyway, yeah, I think personally, I had to really figure out what was I getting out of lifting that gave me so much meaning, and that has become kind of the career arc, the intellectual arc, and just kind of my self-expression. And asking, do I need to be doing a specific lift at a certain level in a specific sport to have that? Um, and the answer was essentially no. I just need to feel like I'm a legitimate part of this community, that I'm contributing, and that I'm still philosophically, trying to progress and move weight and do the things that I think the life lessons that come from the Iron Game, which was a scary but very good kind of conversation to have internally, because it gives you a sense of I'm going to be okay, which I think is important. And injuries are tough because I've had many athletes I've worked with as a coach who they don't get the opportunity to have that conversation before a catastrophic injury happens,
Right.
where then it's taken away from them. And I think that's a very difficult thing to do when it's hoisted upon you, rather than um, this is a potential possibility and I'm going to think about it. That's kind of a very lucky position I think I was in, even though I wasn't a fan of my injuries. So,
Well, I
yeah.
think that ties into kind of the final question that I want to ask you here is, from your experiences and that whole reconciliation of your identity in the community, not just as an
Mm,
athlete, and not just like, what do I mean if I don't do this,
mhm,
and then when people do experience acute catastrophic or acute traumatic that really takes them out, or some type of life event that really influences their ability to participate in their sport, and they don't have the opportunity to reconcile it over time, and they just kind of have to deal with it very quickly, or they're exposed to it very quickly. uh, what what advice would you have for any athlete who isn't even dealing with an injury, so that when they do deal with an injury, their sole identity isn't tied to their ability to perform in their sport?
yeah, I think that is a fantastic question, and it's a conversation that I have with athletes, even when they're not injured. Um, I think as a coach, when you're not inside the experience of being the athlete, you can tell when someone has what I would describe as a non-sustainable relationship with their sport.
Mm-hmm.
At least it's not healthy. They might,
Mm-hmm.
because you can sustain an unhealthy relationship for a long time
Mm-hmm.
with other people, or with a thing.
Right.
Um,
Totally.
and yeah, so it often expresses itself as I might have done really well, or I might have progressed, but I didn't perform to whatever standard I wanted, or I placed poorly because someone else showed up and they happen to be better than me. And now I can't find that same enjoyment out of training or the competition, or even have a sense of accomplishment or pride, or be able to see the positive that came out of that. I'm attuned to that as a coach, because then I feel like they're being robbed of the primary benefits of lifting and sport in general. I think is
Mm-hmm.
we could say that more broadly. And obviously, I don't just tell them how they should feel, but I ask them questions, because with barbell sport, almost in every case, um, people started doing this as adults and not to compete initially. It's pretty rare where you get someone who was like, "Yeah, I competed in powerlifting in high school, and from the start, I did it to compete."
Right.
It's super rare. So most of the time, you have someone who was like, "Oh, this is a cool hobby.
Mm-hmm.
Let me see if I can take it further."
Mm-hmm.
And I think that reference point is really important for this conversation, because you can look back to when you started lifting and remember the kind of attachment and fulfillment you got from it, and the relationship you had with it. And you can juxtapose that to now I'm a successful high level athlete chasing, whether it's a regional or national or maybe even international title, and you're like, hold on, that's supplanted some of this connection I initially had. That's supplanted some of the enjoyment I had. And then the question is, well, how do I get back to that piece of it?
Mm-hmm.
I think an injury is just an accelerant. It forces you to have to face that. Um, Once you start defining yourself not as, I'm Eric and I lift and that's a part of who I am, but I am a lifter. And now even more than that, I am an elite lifter who is vying for a top 3 spot at Worlds. So if I'm not doing that, I can't enjoy my sport. Like, that's kind of sad, you know?
Mhm. Mhm.
So sometimes I ask athletes questions like, "Well, so do you respect other powerlifters?" Like, of course I do. They're awesome. Like, at what level? Like, well, any level, anyone who's trying, but you don't give yourself that respect
Right.
unless you're a top 3. And so those types of questions, I will ask athletes in a much less confrontational tone than even what I just did there. But that's just kind of illustrate a point.
Mhm.
Um, and I think, yeah, like having a multi-layered cake of motivation and relationship with your sport, I think is really important. Like being attached to like enjoying just the process of lifting, like going down in there, regardless of what's on the bar. Maybe like lift heavy, but the experience is an experiential appreciation of the sport, and then an appreciation of just your ability to progress in whatever context that might need to be. And I encourage very broad definitions of that.
Mhm.
An evolving perspective as you lift, even if you're not necessarily getting stronger, lessons from it, etc. Um, and then at the very top, kind of like the smallest part of the cake, the cherry on top, which those Martino cherries, they don't even taste good anyway.
No.
Like the rest of the cake's better.
Someone else could eat
Is
those.
exactly right. That's winning. So I advise and I try to help and I try to facilitate athletes to get that perspective, because then they become much more resilient to these things that impact that. Because there's nothing that can really, I mean, it's not nothing. There are some things that can impact your ability to just participate in lifting at all in any way, whether it's bench only or I just do some bodybuilding or what have you. I mean, don't get me wrong, people do get paralyzed from the neck down, and that's of course tragic. And I'm not the best person to ask about how to deal with that. But for athletes who get most common injuries and even relatively severe injuries, if they have that perspective on their sport, the meat and the primary like benefits they get from lifting are there, and they only have to reconcile and say goodbye to a placing, which if they can adopt that perspective is not the end of the world. It's not cool. Like it's better to have a full cake. It's better to be able to progress like that. That's a harder one to go away too. Like I wasn't a high level athlete when I had to deal with my injuries. I'm never going to be a high level power lifter, but progression is in reaching my own capacity, my own capability is something very important to me.
Mhm.
And when that was off the table, it was hard, even though I still had the enjoyment of the process. And I can go do bodybuilding, and like no one's going to care what my lateral raise PR is. So, and I don't even
You
really
never
care what my lateral
know.
You
raise.
never
That's true. We need to start a
know.
new federation.
How
That's
much
what
can
we
you
need.
preacher curl?
Oh yeah, that would be a good one. I mean, there are strict curl
I
competitions, so yeah.
know.
But I think I had that perspective on like, okay, so I'm gonna have to get different things or less things out of this, or focus on certain things more or less. But I had a place to go, and
Mhm.
I think when an athlete is all about winning and is I'm gonna get that world title and everything else is secondary, and then they get an injury, that can be very tough.
Mhm.
So I think this applies more broadly because it's something you'll have to adopt eventually if you want to stay in the sport or stay lifting.
Mhm.
And I think the most tragic thing is when someone loved lifting, was very, very talented, got to a high level, burnt out, wasn't enjoying it, and then stopped lifting altogether. And I unfortunately have seen that. So, um, and that's even without an injury.
Mhm. Yeah.
So I think this perspective is an important one for wherever you're going to end up going in a competitive sport, generally, in my opinion.
Love it. Love it. Oh, thank you so much for joining us and sharing your story and your perspective. I think that this is extremely helpful for a lot of people because people don't talk enough about it. They might share, you know,
Mm,
social media is highlight reels. I don't even think that there's much out there on this injury. I had to like search for it because I had this idea of my podcast in 2017, and I was like, I want to interview injured athletes, and I put a list. Made a list, and then I was like, okay, well, he's on my list. And then I went to go look for information on your injury, and I like really couldn't find anything. So I don't know how much you've even talked about it publicly, but people don't talk about this stuff. Coaches don't talk about their injured athletes. Athletes don't talk about their injuries. They just talk about their comeback and their performance after, or what they used to do beforehand, you know? And we see highlight reels on social media. And the reality of the situation is that things are not perfect all the time. And whether it's an injury or it's a life event or it's a scheduling issue or the gym closes or it's a natural disaster or whatever, there's always going to be something that interrupts training, and our perspective and the way we handle that and the way that we can identify ourselves outside of training is going to help us get through those things better. So thank you so much for sharing your story. Where can people find you?
The true pleasure. I appreciate the opportunity. I was reflecting, and I'll be brief because I know you're trying to end the podcast. I have talked about my injury a lot, but it's always been in DMs or emails or one-on-one with athletes who reached out to me
Mm-hmm.
because they heard about. I
Mm-hmm.
mentioned it on a podcast tangentially, but not as a topic. And then I had this in-depth conversation with one person. So I think this is a really good thing you guys are doing.
Then we are extremely honored to have this opportunity to share your story. So, as you know, I'm sure it's helped the people that you've spoken with one-on-one. So now it has the opportunity to help more people. So thank you.
Which is great. So thank you.
Thank you.
So yeah, you can find me and the coaching that we do at 3D Muscle Journey and all the links to my science communication stuff, the books that paid for my surgery, monthly applications in strength sport at 3dmusclejourney.com. So that's the number 3, the letter D, and then musclejourney.com, and all the links are there. And if you want to find me appearing on other people's podcasts, not just my own, like this wonderful podcast, follow me on Instagram at Helms3DMJ.
Awesome. Thank you so much. And
Thank you, Eric.
We will link those in the show notes for everyone as well. All right. Thank you, everyone. And we'll talk to you guys next time.